Real people whose lives came to an end because of this pandemic. They had whole lives that were cut short because COVID-19 knows no boundaries and only seeks to destroy.
Scientists are seeking to change that. And when ventilators were in short supply, engineers, particle and nuclear physicists, and medical researchers from all over the world put their own research on hold to design a new, safer, gentler ventilator. Tucked away in a quiet corner of Stroger Hospital, a particle physicist tinkers.
I've never thought I would end up working on something like this.
This is the mechanical ventilator Milano, or MVM. The machine arrived from Italy last week, so scientists here could troubleshoot the design, a simplified version of a standard ventilator.
In my vein of particle physics, I deal with gas detectors, and so I'm used to dealing with pressurized gases and very precise control of the pressure or the flow of the gas. And so some of the skills that I had, and many of my colleagues who also worked on this, are directly applicable to the machine, although at the other end there's a human rather than me just collecting data to understand the universe.
But Fermilab physicist Dr. Jennifer Raff, who's a volunteer on the project, needed the right setting to run her tests. Cook County Health gladly offered up the space and the supplies, a steady flow of medical air, and a patient simulator called the ASL 5000.
This machine, this ASL 5000, which is a very fancy machine, is pretending to be the patient. And the patient that I have it pretending to be right now is a completely sedated patient who needs this MVM to breathe for him. So the MVM is deciding when to inhale and when to exhale. So here is an inhale, and there's an exhale.
Like a standard ventilator, the MVM pumps oxygen into the lungs. But unlike the commercial machines widely in use right now, this stainless steel unit is built with components readily available.
It's very simple. If we were to open it up, you would see inside only a couple of pressure regulators and valves, and those are controlled by a microcomputer. And so we've programmed that to talk to the user interface so that you can do touchscreen actions to set the parameters you need to, and that tells the computer to open and close the valves to make the patient breathe.
Emergency medicine physician Dr. Michelle Sergel helped Dr. Raff simulate the setup at the bedside.
It's built to be more simplistic.
That pressurized air goes into the device, and as long as you have it powered up, that's all you need to be able to provide ventilation to the patient.
With fewer bells and whistles, healthcare providers will have more manual adjustments to make on this unit.
There are different modes on the more complicated ventilators and things we can measure. This ventilator does not have what we call volume controlled, which means we control the volume that the patient gets. This one is a pressure controlled ventilator. That means we control the pressure that the patient gets into the lungs. But if a patient is very sick, this is an adequate way to ventilate a patient, as long as we pay attention to certain parameters.
Right now, there are enough standard mechanical ventilators to meet patient demand, but that doesn't mean research has slowed.
A ventilator is only one part of answering the care for a critically ill patient, but this is one of the pieces of equipment that we have seen as this pandemic started that we could potentially run out of if there's surges in certain countries or states.
It's a simple design to put together. It shouldn't cost that much, and hopefully that means that we can build a lot of them and send them to places that need them.
The device is approved for use during the COVID emergency period, but it will have to go through the full FDA approval process to get on the market.